In this video, I will explain donating and receiving A positive blood type. Let's first start with a patient who has A positive blood type. This simply means that the patient has A antigen on the membrane of the red blood cell, and positive means that the patient also has Rh factor on the red blood cell membrane. The immune system builds antibody against the antigens that we do not have. Since this patient does not have B antigen, the immune system builds antibody against B and releases those antibodies into the blood plasma. So now when I look at my donors, the 8 groups that I have to just keep in mind that my patient is not okay with receiving B antigen because the patient already has antibody against B. Now the question is, which one of these donors has B antigen? And clearly we know the answer. Groups B blood types and groups AB blood types are the ones that have B antigen. So quickly I eliminate these 4 groups from my list, and what is left would be those 4 groups of donors that my patient accept their blood. So a patient with A positive blood type accept obviously the same blood type, A positive. Also this patient accept A negative, O positive, and O negative. So now I realize that if I have positive blood type, I can accept both positive and negative blood types. Then I switch the story and I focus on what if my donor has A positive blood type. In donors, always pay attention to the antigens present on the membrane of the red blood cell. This donor has A antigen and Rh factor. So now when I look at my 8 groups of patients, I just have to choose the ones that accept both A antigen and Rh antigen. So first, I eliminate the patients that are not okay with receiving A antigen. I know individuals who have blood type B and blood type O, they have antibody against A. So quickly I eliminate these 4 groups because none of these 4 groups accept receiving A antigen. Then I look at the remaining 4 groups. Which one of these 4 groups is not okay with receiving Rh antigen? And I quickly remember that individuals who have negative blood type, their immune system builds antibody against Rh as soon as they are exposed to Rh antigen. In short, a negative blood type does not accept receiving a positive blood type. So quickly I eliminate all the negative blood types, and then I am left with 2 patients that both of them accept receiving A positive. Obviously, A positive blood type accept receiving the same blood type, and also AB positive patients accept blood from a donor who has A positive blood type.